When it comes to treating stroke,
There's some concern that you're having a stroke, so we're going to
minutes matter.
1 minute of not having a treatment causes 1.9 or 2 million brain cells to die. If we treat earlier, it's proven that the side effect is less.
The teams at Kaleida Health were meeting guidelines set forth by the American Heart Association and New York State, which say clot-busting medication should be administered in less than 45 minutes for more than half of eligible stroke cases.
But with our resource and with our name in terms of stroke care, we thought that we could do better.
And in 2024, 65% of eligible stroke cases were treated in less than 30 minutes, without compromising safety or quality.
We looked at the steps and we said, what are the redundant steps which are not adding value that we can remove so that we can get the treatment and intervention as early as possible?
This is a team effort, absolutely. So we have nursing, we have pharmacy, we have the emergency department, we have residents, we have neurology, we have endovascular, we have CAT scan. So everybody is part of this to make this work.
The first step in eliminating treatment delays starts before a patient arrives, with paramedics doing the first assessment and notifying the hospital that they're en route with a suspected stroke patient.
We give them the information that we have for the pre-arrival, age, demographics of the patient, what we're finding, positives, negatives in terms of stroke, and history, what medications they take. We try to get as much as we can that can help them when we get here, make it faster.
So our paramedics are our first line to this crucial assessment. As the triage nurse, we are the second.
A page goes out to assemble the entire team quickly.
When a patient comes in with possible stroke, our team here in the emergency department, we actually come out to see the patient right here in ambulance triage.
You're going to look at my nose the whole time, okay? All right? Can you see my fingers wiggling here?
One of their main objectives here when a patient comes in with stroke is to be very efficient, to make a presumptive diagnosis very quickly, and to get all the teams involved and the imaging done as soon as possible.
Previously, doctors did multiple scans before giving clot-busting medication.
Now, after first CT, that's the decision-making point. So we stop, examine, get a consent. If eligible, we give the medication, and then we do the second and third part.
The old school where we'd wait until we had a final decision, be absolutely certain we were doing the right thing, it was like, that's great, but it costs you an hour. You can't do that. It costs you 10 extra minutes.
This is important to get within that window because you have a tight window, 4.5 hours from when we think they were last okay to when we can give that medication where it's most efficacious.
We educated everyone in terms of the time value of this disease. We got such a good result in terms of time metrics. There was no increased bleeding and no other adverse events. So now everyone is kind of used to new normal.
At Kaleida Health, our work continues to improve stroke outcomes, and our next goal is further educating our community about quickly spotting the signs of a stroke. Remember, B, fast, B, loss of balance, E, changes in eyes and vision, F, drooping features on one side of the face, A, weakness in the arms or legs, S, difficulty speaking, and T, for time. Call 911 right away because when it comes to stroke, minutes matter.